Welcome to This Week in Obstetrics and Gynecology. This week we're covering 7 notable papers spanning gynecologic oncology, high-risk obstetrics, and new insights into managing polycystic ovary syndrome. Let's dive in. We begin in gynecologic oncology with an updated guideline on perioperative care and a closer look at surgical approaches for rare ovarian tumors. First, the ERAS Society has published its third updated consensus guideline for optimal perioperative care in gynecologic oncology surgery, featured in Gynecologic Oncology. This 2026 update synthesizes the best available evidence, with an emphasis on meta-analyses and randomized controlled trials graded using the grade system. It provides a comprehensive framework for gynecologic surgeons to design and implement enhanced recovery after surgery pathways. Within that framework of optimal surgical care, a study also in gynecologic oncology addresses a critical question for rare tumors. In a multi-center study of 337 patients with stage 1 adult granulosa cell tumors and Sertoli-Leydig cell tumors, researchers compared outcomes between minimally invasive surgery and laparotomy. While minimally invasive surgery itself was not independently associated with worse disease-free survival after adjustment, a key finding emerged. Tumor morcellation, which occurred more frequently in the minimally invasive group, was independently associated with a nearly threefold increased risk of recurrence. The 10-year disease-free survival was significantly lower in the group that had laparoscopy versus laparotomy, at roughly 54% versus 74%. These findings underscore that the fundamental oncologic principle of intact tumor resection is paramount, and morcellation should be avoided when a minimally invasive approach is considered for these tumors. Turning to high-risk obstetrics, a new meta-analysis questions a standard of care for twin pregnancies, while 2 other studies provide critical data for counseling on rare but serious conditions. In a potentially practice-changing systematic review and meta-analysis from Obstetrics and Gynecology, researchers analyzed 16 studies, including over 18,000 neonates, to assess the benefit-risk profile of antenatal corticosteroids in twin pregnancies. The analysis found that steroid exposure was not significantly associated with a reduction in neonatal mortality or respiratory distress syndrome overall. Concerningly, corticosteroid exposure was associated with an increased risk of several neonatal complications, including an 80% increased risk of hypoglycemia, a 72% increased risk of requiring supplemental oxygen, and a 33% increased risk of admission to the neonatal intensive care unit or special care unit. While the authors note the evidence certainty is moderate to low and findings should be interpreted cautiously, this paper strongly challenges the routine extrapolation of singleton data to twin gestations. For patients with another high-risk condition, cesarean scar ectopic pregnancy, data from a large international registry. The study followed 115 cases that continued beyond the first trimester. About 2/3 progressed to viability, resulting in a live birth. However, the morbidity was substantial. Over 40% of women required a peripartum hysterectomy. The study identified key first-trimester ultrasound findings that can help risk stratify patients. A residual myometrial thickness of less than 2.5 millimeters and the presence of enhanced subplacental vascularity were both significantly associated with an increased risk of subsequent hysterectomy. This information is critical for guiding patient counseling and optimizing management. Finally, in the realm of advanced prenatal diagnosis, a study in ultrasound in obstetrics and gynecology details a multimodal approach for fetuses with cardiac rhabdomyomas, which are known markers for tuberous sclerosis complex, or TSC. In a cohort of 80 fetuses, the presence of multiple tumors on ultrasound was a sensitive but not specific predictor for TSC. Fetal brain magnetic resonance imaging, however, demonstrated 100% specificity, identifying central nervous system lesions in nearly 90% of fetuses with TSC. The study also highlighted the essential additive value of trio whole exome sequencing, which identified pathogenic variants in TSC-positive cases even when fetal MRI appeared normal. This demonstrates that an integrated approach using both advanced imaging and genetic testing is required for the most accurate prenatal diagnosis, which is vital for counseling given the severe outcomes, including a nearly 90% termination rate in the TSC-positive group and postnatal epilepsy in all live-born infants with TSC. Our final theme this week focuses on polycystic ovary syndrome, looking at both a serious comorbidity and a potential new therapeutic avenue. A large retrospective cohort study in BJOG, using the TriNet X United States Collaborative Network, evaluated the link between obstructive sleep apnea and thromboembolic events in women with PCOS. After propensity score matching of over 20,000 women, the study found that a diagnosis of obstructive sleep apnea was associated with a nearly doubled risk of pulmonary embolism and a 32% increased risk of venous thromboembolism compared to women with PCOS but without sleep apnea. These findings support stronger consideration for obstructive sleep apnea screening and enhanced thromboembolic risk assessment in women with PCOS. And on the treatment front for PCOS, a proof-of-concept analysis in fertility and sterility explored the impact of semaglutide. This analysis found that weight loss associated with semaglutide use was linked to improved reproductive measures in women with PCOS. While preliminary, this study provides early evidence supporting a potential role for GLP-1 agonists in improving reproductive health in this population, pending confirmation in larger trials. If you only have time for one paper this week, make it the systematic review and meta-analysis on antenatal corticosteroid use in twin pregnancies by Philippe and colleagues in Obstetrics and Gynecology. This paper directly challenges the routine practice of extrapolating singleton data to twins, finding no clear benefit for mortality or respiratory distress syndrome and potential harm, including increased hypoglycemia and neonatal intensive care unit admissions. It's a critical read that may prompt a re-evaluation of current protocols. Here are the key takeaways from this week in Obstetrics and Gynecology. First, in twin pregnancies, the evidence for antenatal corticosteroids is weak. A new meta-analysis found no significant reduction in mortality or respiratory distress syndrome, but did find an association with increased neonatal hypoglycemia and neonatal intensive care unit admission, urging a cautious and individualized approach. Second, for women with polycystic ovary syndrome, be aware of a heightened risk for thromboembolic events, particularly in those with comorbid obstructive sleep apnea. The risk of pulmonary embolism may be nearly doubled, suggesting a lower threshold for sleep apnea screening and VTE risk assessment. Third, when performing minimally invasive surgery for rare ovarian tumors like granulosa cell or Sertoli-Leydig cell tumors, avoiding tumor morcellation is critical. A new study links morcellation, which is more common in minimally invasive surgery, to a significantly increased risk of recurrence. Fourth, when counseling patients with a first trimester cesarean scar ectopic pregnancy who are considering expectant management, new registry data can help quantify the risks. While 2/3 may reach viability, over 40% will require a peripartum hysterectomy. A residual myometrium, less than 2.5 millimeters on ultrasound, is a key high-risk marker. That's your roundup for this week in Obstetrics and Gynecology. The full transcript and references are available on the episode page in your Audio Scholar library. This is an AI-curated summary. For clinical decisions, always consult primary sources and current guidelines. See you next week. This is an automated summary generated by artificial intelligence, which can make mistakes. Always review the original source materials.